So first off, I want to thank MPP Cazzetto for being the sponsor for allowing Diabetes Canada to come in here today and talk about the stories that we've been hearing from families in relation to keeping their kids safe in school. And it is something that is very important for us at Diabetes Canada, so much so that we've got all of our executives out today. Dr. Shane Green, our SVP of Mission, our CEO, Laura Siren, who is standing behind me. And the most important people that are here today are the families and some of the children to talk about the experiences that they are having in some school settings across the province of Ontario. But what we are doing here today in Ontario is launching a national campaign to ensure that kids right across the country can go to school feeling safe, knowing that their diabetes will be well managed thanks to the policies and procedures that we are advocating for to get in place. And without further ado, I will ask our CEO, Laura Siren, to step up and say a few words in relation to the importance this issue is for Diabetes Canada. Laura?
Thank you, Glenn. And good morning, everybody. I'm here today not just as the President and CEO of Diabetes Canada, but also as someone who lives with type 2 diabetes herself. I can tell you, as can all these families here with me, that diabetes as a condition is relentless. It doesn't ever take a day off. And certainly in the school setting, it doesn't pause for school bells or recess or final exams. So today, you're going to hear directly from families about what it's like when the school system fails the children who live with diabetes. These aren't isolated incidents. This is happening in schools across Ontario, as well as in almost every province and territory across this whole country. Children living with diabetes in this province are simply being put at risk because Ontario doesn't have a mandatory standard of care for students with diabetes who attend school. A child's access to safe and consistent care at school should not depend on which school board they're in or which principal happens to be making the decisions. But right now, that is exactly what's happening. Without clear provincial standards, we're seeing preventable health emergencies taking place. We're seeing children excluded from activities that their peers get to take for granted. We're seeing families forced to choose between their own jobs and their child's safety at school. The solution is clear, and it is within reach. 3 provinces, Nova Scotia, PEI, and British Columbia, already have mandated standards that align with Diabetes Canada's guidelines. Ontario and the rest of Canada must do the same. That's why we're today calling on the Ontario government to lead this push and adopt and mandate Diabetes Canada guidelines for the care of students living with diabetes at school. That means individualized care plans for every student who lives with diabetes, trained staff, and allowing students to use the technology they need to stay safe in the classroom. Educators we know want to help, but without provincial support, they lack the training, the authority, and the protection to do so safely. Diabetes Canada is here today and always to support these families. We stand alongside them, and we will continue to work on their behalf until every student in Ontario and across the country has the support they need and deserve in school. No child should be unsafe at school because they live with diabetes. Ontario must act, because every student deserves the support that they need to be safe and healthy and included at school. Thank you.
Thank you, Laura. And as you can see behind me, we have Catherine, Alana, Jenna, Susan, Andrea, and Amy. The power of mums. And if this government should be afraid of anything, it should be afraid of the power of mums. And when mothers come together and talk about what they need to do to protect their kids, we all need to act. And so that's why we have some mums here today to talk about what they're doing to advocate for their children's safety in schools. And the first person I'd like to call up is Jenna to speak to her story. So Jenna, floor is yours. Thanks.
Good morning. Thank you, everyone, for having me here. So my son was diagnosed when he was 14 months old. He is now 6 years old, and he is in grade 1. Now, a little bit of background. Both my parents were type 1 diabetic, and 2 of my uncles were type 1 diabetic. I lost both my uncles to long-term complications from type 1 diabetes. My one uncle was as young as 40. My dad passed away in 2013, and my mom moved in with us in 2019 and passed away in 2023, again from long-term complications to type 1 diabetes. Why am I telling you this? Well, our kids are in the school system 6, 7, 8 hours a day, and the diabetes management is so crucial. These long-term effects with the technology we have these days can be alleviated, but it's like walking a tightrope every day. A little too low, a little too high can put the students at risks. With the students at school, 33% of the time, we need policies to advocate for these kids. People living with type 1 diabetes make, on average, 170 decisions a day. And those decisions for a mom with a 6-year-old kid fall on me, fall on my husband. And they have to be communicated through a policy, through a medical policy, and implement guidelines to help manage his diabetes. I want my son to grow up strong. I don't want these long-term health effects to affect my son, Emerson. And with everyone's help here today, we can alleviate that. So I look forward to work with everybody, and thank you for having me today.
Jenna, thank you for sharing your story. You're also hearing a lot of beeping going on and vibrations. A lot of us are here with medical devices that are so important to help us manage our conditions. I, too, also live with diabetes. And, it is a condition, as Laura said, that is relentless. And, again, speaking of relentless, it's the moms that are in this room that want to make the change. And I know Amy and Alex, who wearing a Blue Jays T-shirt, so go Jays, got that in, can come up here and tell a little bit about their story as well. So Amy and Alex, thanks.
Right. Hello, and thanks for having us here today. I guess we're here all for the same reason, that we want our children kept safe in schools, in Ontario schools, which the policy hasn't always been good enough. It's failed our children in keeping them safe. Every school year, I think the last 2 weeks of summer, when you should be enjoying the last little bit, it's terrifying writing ICPs, getting doctors' signatures, trying to keep our children safe, trying to run 500 steps ahead to make sure that our children are safe at school. And then we have to hope and trust that the school boards and the policies will protect our children as well as the staff. And it's really hard. It's really hard, and it is so important for a policy to change to protect our children, because it's failing our children. There's too many days where we have to phone the schools. Too many times we can't even have proper full-time employment because we have to micromanage our children's school days. I think that's fair. It's a 24/7 autoimmune disease, and it's like running a marathon nonstop every second, day and night. And we need to be able to have the support of the school boards, the support of the government policies across the country. We shouldn't have to decide where we want to live, which province will help our children the most, which area postal code it has the best school board that will support our children. We have moved once during the COVID era after having 3 years of virtual school, just because, and sadly, I felt safe. I felt safe doing virtual school because I knew Alex would be safe, because I was watching her. I didn't have to worry about the calls into the school. Is she high? Is she low? Is she okay? And that's about it. That's why we're here today. We want better things for our children, and I know you guys can do better. Thank you.
tough to listen to when you think about sending kids to school, knowing that we need to ensure that they're safe. And I know Alana has talked to us a lot about important things that need to get done. One statistic that Alana talks about is 37% of families that have a child with T1D, one of the parents has to resign from their job. It actually has an economic impact as well. But really, at the end of the day, this is about quality of life and safety for kids. And so that's why, for us, Diabetes Canada is going to be relentless in advocating to governments right across this country to make the changes that are necessary. And what we're asking for is very, very important to these families, and it's also very important for all of the school boards to actually start doing these things, and that's why we're calling on the government to actually implement these mandatory standards of care policies that aligns with our guidelines, like our CEO had mentioned, to ensure that diabetes management needs are met adequately and supported through policies, and that they're implemented equitably across school boards. We implement policies that require schools, parents and caregivers, and healthcare professionals to work together to develop an individualized care plan that clearly addresses both an emergency prevention and a response plan, and a daily diabetes management plan for each student with diabetes. We also want to ensure that a daily diabetes management plan specifies the education required for school personnel. So a designated safe space for students to complete glucose monitoring and administer insulin, including the adult support and or supervision they require. And of course, permit students managing their diabetes to carry a cell phone or a smartwatch to receive important diabetes management data from medical devices. We are going to continue to work on these. All of these have to be nuanced, but we can do this together. We've got 3 provinces already doing this. And so for us at Diabetes Canada, we look forward to using the power of mums to make the changes so we can ensure that all children are safe in school, and in this province and in every province and territory in Canada. And with that, if there's any questions, we're also happy to meet afterwards. But again, I want to thank MPP Cazzetto for being the sponsor of this media studio today. I want to thank all of the mums for enduring Toronto traffic, for Gracie for sitting through question period like a trooper, kind of, sort of, but Gracie was awesome, and Alex was awesome, and all of the mums for coming out, for being here today, for telling your story. And I look forward to working with all of the MPPs this afternoon, because you've got some very passionate moms who are going to be sharing their stories. So thank you, everyone. Thank you again. Have a great day. Thank you.